to say, I wasn't deadly ill,
Yeah.
but I was ill.
Yeah.
Really ill.
It hits you in a way that the typical flu doesn't.
It's not at all.
Normally. No, you can tell when you get it, you're like, what is
And
this?
it's like, it feels like there's an inch between your head and your body.
Yeah, yeah, I was taking, what's that called? Alka-Seltzer Plus for cold and flu. Because it reduced the swelling in my nose and my throat, so I could keep breathing.
Yeah.
It was weird.
Oh, I was totally surprised, how different it really was from the flu.
Yeah,
You know,
yeah, the flu
not-
destroys you up here and in your bones. COVID destroys you everywhere else.
I just, we're gonna be looking at some more of this stuff. This was a new one.
Mhm. Yeah, I'm nervous about it. I'm like, I'm ready. I got masks left over that I'm keeping in the house for when they announce the next one.
Yeah, well, I just went on to the government website and said, send me 4.
Nice. Hi, Eddie. Oh, he's still connecting to audio. Eddie's my executive director. Hi, Eddie. Okay. So it sounds like you're doing okay now.
I'm doing better. I have a short energy use.
Yeah, yeah.
That's the biggest thing that's so disappointing.
And it lasts for months and months.
I can't, you know, I mean, I normally have tons of energy with long days.
Yep. Absolutely. And it just takes it out of you. It takes away your ability.
Well, we keep thinking next week we'll be up to normal
Yeah,
and
no,
so
it's the same strange, dreary, draggy thing. Yeah, it's just like, what is wrong with my system? I was like, I don't get it. It's just whatever it
I
does.
think that
It's
you had
weird.
COVID too.
Yeah,
Yeah, so you can, you know, what I'm talking about.
yeah, absolutely.
I like your challenge. I was reading about it today.
Was reading about it. Was it in the newspaper? It was in today's.
I think it was in today's paper.
Oh,
I saw
wow, I
something
didn't know it
today.
was gonna happen that quick.
Yeah,
Okay, I'll get one on the
I'm
list.
planning now, so. But yeah, no, I. Glad to see that.
It's actually on the news, Redwood News. The other one, yeah.
Oh, yeah, we didn't need
I
it
usually
like
miss
that.
the news.
Oh,
Hello, hello. I'm hogging the seat. I have a name tag now. Yay. Our own system.
congratulations. Hi, Paul.
Everybody.
So time standard, I see. The second part.
I had three, I didn't realize, I told Sage it would probably be.
How you doing, Debbie?
Yeah. From the event. But,
What did you guys think about how it went?
So,
We were incredibly happy with how well it went.
Good.
And we had a total of 700 information referrals. Yeah,
That's fantastic.
that's astronomical. And that was just the begin. That I came up with.
That
Yeah.
was from the tickets?
Yeah,
Yeah. Okay.
yeah. And so next year, when people
Good
more
way to
better,
do it.
yeah,
It's a beautiful
Yeah.
day.
we're gonna get even more. I'm hoping to have a total of 40 vendors and upwards of 1,000 vendors.
Are you guys?
We are discussing that right now.
We want to get a
Yeah, it was very quiet in the morning, and we are going through the different process of putting out surveys and, everything to figure out if we are going to stay on Friday, do Friday evening, do Saturday, you know, and during the, summer versus after school starts in September. So,
It's just,
but it's like bizarre. Yeah, absolutely.
yeah, it's hard and there's pros and cons.
What about?
Hi, you can sit wherever you like.
Okay.
Yeah, we've got seats over here, we've got seats back here. Yeah.
how y'all doing?
I saw you on TV.
Oh, thank you.
We're gonna everybody's seeing now. We're gonna go start doing autographs.
No. But I can say this, and I don't know how that person with lived experiences has either been in the newspaper or on the news as much as I have. And it's time to put, it's like I told the reporters, it's time to put someone else in front of the camera.
Yeah, that's
You know
true.
what I'm saying? It's time for someone else to.
But in order to find someone else, they probably be, it would be helpful for them to have someone who can kind of guide them to that place.
Yeah.
Take them along.
Yeah, I was gonna say.
Yeah, if you're like the central advocate, then people know to come to you and then you can lift up their voices. But it's either you first have to be the face and then you bring them all up underneath your wings.
I'm good. So I. About that November and then I called you about. So I saw that said. You were not available. I know, that's what I thought. I think there's a lot of cooks involved in that.
Yeah, when I, you know. In response to the request for a mental health profession, I did looking and say, hey, so if you want someone in your panel, I think we can find a better fit.
I was in there.
Panel, right?
I got it already
I don't think I ever said. I was-
Then I did with Salvation Army and it's growing really fast this time. And I'm like, oh. That's what we're working.
I don't feel 17.
I like all that.
Thank you, everyone. 12:17, I'd like to call this meeting to order of the Humboldt County Behavioral Health Board. Welcome to the meeting. Sorry, I'm a few minutes late. We are the advisory board for the Board of Supervisors. We hold this meeting on the fourth Thursday of each month, and it runs from 12:15-ish until 2:15. We meet in person at 507 F Street in Eureka. This is a public meeting and everyone is invited to attend. Members of the public may participate remotely. The minutes and agenda can be found by Googling Humboldt County Behavioral Health Board. You will find such information within a list of committees. We provide time for public comments early in the agenda. Public comments need to be limited to 3 minutes and pertain to matters related to behavioral health. We ask you to make your comment in a respectful manner. Please note this meeting is being recorded. Please contact me or any of the behavioral health board members if you have any questions about our work as a board. So with that, Joe, we can do roll call.
Sure. Alyssa Norman,
Here.
Laura Montagna,
Here,
Steve Madrone. Virginia Grass,
Here.
Here,
Ben Jelly, excused, Allison Vance, excused, Debbie Hartridge,
here,
Colleen Broderick,
Here.
Jeanette Kellerman, excused. Vernon Price,
Here.
Gardner Carlson, excused, Oscar McGowan. Catherine Smith, excused, Lenore Ramirez,
here.
you do have a quorum.
All right. That will proceed with the introduction of staff and guests. We can just go around the room this way. Staff.
Good afternoon, everybody. I'm Oliver Gonzalez, Program Manager at Behavioral Health Branch for the Mental Health Services Act.
Good night.
Paul McNackey, Deputy Director, Behavioral Health.
Christine Messenger, Communications Group.
Joe McNabb, Executive Secretary.
And online,
Jack Brazil, Deputy Director of Behavioral Health.
Paula Peltier Olson, Lead Organizer of the Humboldt County Transition Age Youth Collaboration.
Hi, Sharon Wolf, Legislative Analyst for DHHS. Good to see you.
Hey everyone, Sonia Levy Boyd, supervise the Humboldt County Transition Age Youth Collaboration, the peer coaches at the Tate Division. I use she, her pronoun.
alrighty, and then guests. Anybody else? If you don't mind introducing yourself.
Hi, I'm Marguerite Story Baker. I'm a resident of McKinleyville and a former board member, and I've come back after 3 years to see what the board's doing and maybe rejoin.
I'm Tom Too, also a McKinleyville resident. I been a member of the board for 10 years, and I'm looking forward to how it's shaping up.
Thank you. And then, online. Yes. Eddie.
Hi, thank you. I'm Eddie Morgan. I'm with Tri-County Independent Living. I'm there with Alyssa, and I'm the Executive Director.
Thank you. I think we got everyone. Yes. Oh. Hiding in the back.
What? Oh, yeah, I'm over here. I'm Laura Coulter. I'm the Administrative Secretary for Tech Brazil.
Thanks. All right. Are there any adjustments to the agenda? Anyone? Gone. All right, agenda stands. And now is our time for public comments. So, does anybody have a comment from the public? Yeah.
I've been recently involved with befriending homeless people where we live in Humboldt. And it occurs to me that the previous system of just having temporary and then most of the therapeutic and drug or medication oriented emphasis from the mental health community is not doing all that great of a job. I think it's very easy for us to be complacent about coming to these meetings and expecting the same result, which is massive amount of homeless mentally ill people. They're all over the place, and I understand there's an effort to get a building or a kind of step down other than temporary where homeless or mentally ill people can stay for a while and get therapy and get hooked up with services. I'm very much supportive of the medication program. Something that mental health does exceedingly well. But it's not enough. there has to be more outreach, there has to be more buildings for that particular cause, that should be, going on, and I basically am amazed every day when I go by the Joyful Healer or talk to some mentally ill people or homeless people, that mental health is failing them, and you only have 18 beds or so, 16 beds at Temple Byron, and compared to the absolute need for more, that there's basically, we're not doing enough. And so I would encourage people to not necessarily just look at Temple Byron and say they're doing a great job and whatnot, because they are, but there needs to be more. And if you ever spend time with some of the homeless people in the community, mental health and substance abuse are rampant. And I'm encouraged by signs that there is going to be a more of an effort to come up with homeless shelters and whatnot. And I'm sure they'll do a good job, but it's so obvious to me that that we're failing the homeless, mentally ill, homeless, substance abuse issue, and getting down to their level with an outreach program that is significant and robust.
Thank you.
All said, thank you.
Thank you very much. Any other public comments? There's something that already. Sonia,
I have, yeah, I do. Thank you. I was just wondering if there was an update or if there will be later in an SUD subcommittee and if that was being looked at again to start within the VHB.
yeah, I'll give you an update later. In this meeting.
Do you have another comment?
Yes.
I guess I just wanted to say that I'm interested in the same thing she just mentioned. I used to be, the alcohol and drug administrator of Sacramento County when I was working. And when I was on the board, I was the last person before the pandemic in charge of that committee. And so I'm very interested to know what's going on with that. And I share Eric's concern about the combination of mental health and drug problems and homelessness. And so I'm going to be very interested in what the board has more currently been doing, because I've been out of the loop since the pandemic. Thank you.
Thank you. Else? That concludes public comments. Moving on to action items. Has everyone read the minutes? And somebody wants to.
I did, and I moved to approve the minutes.
There's a second.
Second.
Seconds. The vote to approve, approves the minutes. Take the vote for all in favor of approving the minutes. Raise your hand or.
Aye.
Thank you. Are there any opposed? All right, the minutes are approved. Discussion items. Bylaws. So after this meeting, Joe is going to email everyone on the Behavioral Health Board the bylaws, which have been in process of being revised for a little while. And unfortunately, Tim Doty is not here this meeting. He's worked very hard on them with Tim Ash, who's not a member anymore, but they will be sent to you. And our goal is that we deal with any questions, but then vote on approving them next meeting. So they will be emailed out to you. And if you have questions, ask me. Does anybody have any questions about that process right now?
I just have a question. When you say to send you, we'll get them and then we're gonna approve at the next meeting. And if you want another question, then we just one-on-one send you a question if we have one? Okay, because I thought other people may have some of the same questions, so I don't know.
So the revision of that started before I was even on the board, so there's things that we may have to ask Tim Ash, and Tim Doty's out of the country for a while. He will be back for the next meeting, but.
Haven't they been working on this for like 5 years?
Yeah. Sometime.
So, yeah, we're looking for
It's-
understanding, but to move forward.
Yeah, no, that's fine. It's just I just wanted to make sure the questions were asked at the right time, if I had any.
Yes. And, so if there's no other questions on that, just be aware, please, as soon as you get them, read through them. It's not a 1 or 2 page thing, it's several pages. So hopefully I'll hear back from everyone. And I guess if you're like, yep, that looks good to me, just please send me an email, let me know that as well. So Catherine Smith, the next item 6A is the SB ad hoc committee. She is ill, she's not here. We spoke about this at the executive committee. Colleen was gonna work with her, but can't at this time. So if there is one other person from this board who has any desire to work with her on that ad hoc, do you have some comments? Oh. Okay, awesome.
I would love to participate. For the record, I would like to participate in this, but I cannot, will not share.
Okay, looking for some other co-person, but that's great.
I tried to share one and it didn't work out. So this will give me the opportunity to learn.
Great. No other discussion on that. I will guess we'll go to communications and start in the room. That's,
Well, Tri-County Independent Living had its expo. Yeah, the 15th, it was a rousing success. We had around 33 vendors and a lot of community members showed up, and we had a total of 700 information and referrals. From the way that we set it up, it was a rousing success, and we're thankful to DHHS for all the participation. There were several different divisions and groups that came to and do outreach at the event, and that was a wonderful experience. Thank you.
It was fun. We were there.
NAMI was. I have a couple of kind of announcement type things, Laura. One is, NAMI is doing their 8-session family to family course starting on Wednesday. And I did send out information about this before, but signups are still open. We actually moved it a week because we didn't have enough people last week. So it's a lot of families who do this course feel that it helps them, it creates a bond between people who attend, and they learn a lot. So it's something, if you want to still recommend people, I have some contact info here, and I only brought one flyer. I have sent it out before to the behavioral health board, so, but if anybody wants more info, I have this flyer. And that's one thing. Another thing is that with NAMI California, we are putting together a conference for November 4th. And this is taking a while to gel. There will be a flyer. I think I relate to Danette about that. She kept coming back and saying there will be a flyer. Anyway, there will be a flyer. November 4th. Focus is multicultural issues and mental health. And we do have some speakers lined up. We don't have everyone lined up at this point in time, but Ruby Byan will be speaking. Dr. Byan, she is the director of Waterfront Recovery Services, in case you don't know who she is. And Greg O'Rourke, I believe, who is he's the head of the Yurok Tribal Police, and he does has been working on the CIT trainings over the years. So he will be there. There are several other people, and I'm not gonna mention everybody because I think everyone is entirely firmed up. But I'll say one more person. I'm hoping that Judith Serber will be there, who is from the Hupa tribe and has written a book that I have read. It's a novel and it's called Reservation High, and it's about substance abuse issues, and it's kind of, it's kind of a romance novel with a local setting, and it's just a good way to bring up topics, I think, and for people to relate to somebody else who's having the same issues. So hopefully she'll be there. That's two. Number two. My number three thing is that if you're familiar with OLLI classes, which it's courses for people over 55 or 55 and better, as they like to say. That's their slogan. I think it's 55 anyway, but they do, one of the programs they do is called brown bag lunches, which are on Mondays. They're an hour and a half, and they have different speakers for these brown bag lunches. Anyway, one of the topics is on October 23rd is being presented by the League of Women Voters, and it's called A Study of Behavioral Health Services in Humboldt County. And the League, I'm a member of the League of Women Voters, and I was part of this study process, which we talked to a lot of people with mental health, dealing with mental health programs, including the person who is doing the substance use program, who has to go work from bigger county.
Raina West.
Yes, we talked to Raina, we talked to people from Semper Virens, and various different knowledgeable people in the mental health realm. And so what the League does is they put together a statement about mental health for use by them for advocacy purposes, really. So that's what the process is about. But anyway, they will be presenting on October 23rd, the brown bag lunch. And what the League's goal is supporting mental health services in Humboldt County. So it's just a reminder to everyone, staff and us board members, to think of them as a potential partner in advocacy if something comes up and advocacy is needed. My spiel.
I'm sticking to it.
Sticking to it.
Thanks.
Okay.
There any other communications from board members? Yeah.
My name is Vernon and I'm a board member. I had the honor and privilege of having 3 tabling events with the Hope Center and to celebrate our Recovery Happens, National Alliance for Mental Illness Out of the Darkness Walk, and at the event that our Deputy Vice Chair put together, the expo. We met a lot of people that did not realize what the Hope Center was, or there was a Hope Center. So as I was invited to participate in this, I realized that there is a lot of communication that we need as a board to try and table at events also. We can learn a lot from this. Thank you.
Just like to remind everybody, there's the 3rd series in the community health town hall sessions is this Saturday. So it's from 1:30 to 4:30. Yeah, 1:30 to 4:30 at City Hall. So the title is Today's Mental Health, Tomorrow's Future, right? Raising Resilient Children. So I encourage folks to go.
Anyone else? So I'll just talk about the SUD group. Danette and Leo, I believe, have agreed to work together as co-chairs on that committee. And I'm sorry that Annette's not here, but at Recovery Happens, spoke with her at length, and there were several people who, a few from Southern Humboldt, who are very interested in also being part of that committee in the substance use disorder group of people. And so Leo has graciously, yes, offered to co-chair that. So we have 2 solid people now, and I'm just getting them up to speed. Did somebody have questions about that, Sonia?
Historically, HCKC and our youth advocacy board members have participated on the SCD subcommittee. So just looking to reconnect, see what our capacity is and attend. So whenever those get going, to be involved.
Excellent. Absolutely. Okay, that was one thing. That's all I have from that. So we do not have our DHHS director here or behavioral health director. Or we have Laurel, but we've got Paul. Hi, Paul. No pressure. Yay, we have Paul.
Well, I can't speak for Connie, but I do have a few reports. So a small group of us went back down to Orange County to do some more research and connecting with resources down there to move forward the crisis triage center that we're planning with Mad River Community Hospital. So we visited a couple different hospitals and went back to Be Well in Orange County. Was a very productive meeting. And we've also been meeting with some of their finance folks and their developers. So that have a lot of experience working with the V-chip dollars and all of the conditions associated with that. So it was really productive. Appreciate everybody that came with us and participated in that. We had our switching gears. We had Semper Barnes had their triannual CMS review last week. So these are federal reviewers that come in and review Semper Barnes. So we'll have a corrective action, or as I listed several things that they're mentioned in their exit report, but we'll see what ends up in the final report. But we're already getting started on making some of those corrections now. So our team's actively doing that right now. So more to come on that. And then next week, we have our external quality review organization for the whole department of outpatient services. This is the expected annual review of an external entity that comes in and reviews mental health plans to go over the whole system and make recommendations to see what we've done since last year and with their recommendations from last year. So that's coming up next week. And these are it's a good opportunity to review the report and to see, because they really get into everything. We give them a lot of documentation of things that we're doing in the department. So it's a good report for the board. So I just wanted to put that on your radar. And also our CIT training that we typically have in the fall, we're postponing that to the spring. So we had some contracting issues that came up and things were coming together as quickly as we were hoping to. So the steering committee moved the training to the spring. So that's still happening, just a little bit later. And then a couple other things. We have a mobile crisis benefit that is going to be rolled out to counties. It can be rolled out now if counties were prepared to submit an implementation plan about the readiness to leverage that. But essentially what the mobile crisis benefit is It's a new funding structure for mobile crisis teams to provide services out in the communities, not in emergency departments, but out hopefully upstream, catching people early before they go into a crisis where they need to be, stepped up to a higher level of care. So we're working on a plan, an implementation plan for that to submit to the state, and the state approves it, and then they approve us for being able to draw down on those dollars. So what we like about this benefit is that the payment structure is different than what our current payment structure is for mobile response. So it's a little more inclusive of other things that crisis teams typically do that haven't traditionally been reimbursed. So we're all excited about that, but we're hoping to expand out the mobile crisis benefit and expand our teams a little bit more, including more providers. So we're looking forward to that and how that's developing. But we'll keep you posted on that. And then lastly, I just wanted to just mention that we are expanding out our telehealth services for psychiatry. So we currently have it in place for adults and children in Garberville, at our Garberville Center, as well as in Willow Creek, at Willow Creek Center. We're currently getting equipment in place for the center in McKinleyville, the center in Fortuna. And yeah, so that'll give us 4 communities that we're expanding that service out to. So folks that, are from Fortuna area, they can go to Fortuna to see their psychiatrist rather than having to come all the way to town. Same thing for the surrounding community. So we're really excited about that. Right now we're growing it, so it's 1 day a week in each of those spots, but I'm sure it'll expand as the schedule allows for. So that's it for behavioral health.
Who's that program staffed by, a psychiatrist, the televisits?
Yeah, so we have our existing psychiatrist that have our outpatient services, and then we'll have a nurse that's in person at the center that's doing the intake and welcoming and doing vitals and things like that before they go into to meet with the psychiatrist for telehealth. Yeah.
Thank you.
Yeah.
Remind me, how much of psychiatric services is provided that way on video? Is there an in-person psychiatrist?
Yeah, we have in-person psychiatrists, both on the children's side and the adult side, and all of our psychiatrists except 2 of our contracted psychiatrists don't come into the centers at all. So the rest of them come in periodically. Usually it's once a month for a week or quarterly for a week. But we do have them in person part of the time as part of the contract.
How many of them are there about?
Oh, let's see. 2 in children's. And 5 in adults. One of them only works 2 days a week.
You mentioned corrective actions for Semper Virus.
Yeah.
I was curious, what might some of those corrective actions be that you're actually
Well, I'll give you one. One
Okay.
is, and again, it's preliminary, so we don't know.
Right.
But they did ask us a lot of questions around humidity control in our pharmacy on Semper Virus. So, we have an old building, so, there isn't, there's a ventilation system and an air intake system and heating, but there isn't an air conditioning and there definitely isn't humidity control. So they were really honing in on that in the pharmacy. So, but, to our credit, we do have an air conditioning unit in the pharmacy, Semper Virus. So we might need to move it aside a little bit to make room for a dehumidifier. But we'll see. So that's one.
So that's kind of along the lines of what they were talking about, nothing pertaining to patient care.
Oh, they're always finding things about patient care around, this time they had a lot of questions about our new electronic health record and how it's functioning, and particularly around the treatment planning for consumers and what that looks like in the system. So there may be some issues there that come up that we might need to take care of.
But that'll come out in the report.
Yeah.
Absolutely. Thank you.
So, excuse me, so how would the telehealth work in McKinleyville? That's pretty plan.
How's it gonna work?
Yeah.
If somebody is living in McKinleyville, for instance, they have regular, services established with a psychiatrist, they could say they'd rather have that up in McKinleyville. We'll set the schedule for that, whatever frequency that might be for that person. So they're on the schedule and then they come in, walk into the center and say they have an appointment with Dr. Appel and for behavioral health, and they'll walk them back to the office. They'll be welcomed by the nurse. Nurse will do their intake in one office and then bring them into the telehealth other office where the telehealth equipment is. So it's set up a lot like it is on the third floor at 720 with our telehealth. So
So when you say it's at the office in McKinleyville, are you talking about the office in the building behind Starbucks there?
yes, on Hartwood, yeah, yes, the center at Hartwood, yeah.
Thank you.
Yeah, we're kind of back in the behavioral health section, sort of by where Open Door has their office on that side.
Thank you.
Could you describe to me, what the triage, you mentioned triage, is that about a current building, or what exactly does that differ from the navigation center?
Yeah, it'll be different. The navigation center is Connie's project, and that's what will be here in Eureka. But this will be up on the campus of Mad River Hospital. So that land has been donated by Mad River, and so we're gonna build up there, and it'll be a 12-bed sobering center. It'll have an adult and adolescent crisis stabilization unit. It'll have crisis residential beds as well as SUD crisis residential beds.
Okay, so, that is going to be looked at as a step down from Trevor.
Yeah, because it's not acute, but it is crisis. So the sobering is, under 24 hours typically. The CSUs are, under 24 hours. And then the residentials, our crisis residentials are 30-day programs typically, could stretch into 90 days. Yeah.
Thank you. That's great.
So,
Just a quick question. So the target date for having that up and running, or is there one yet? Or?
Yeah, we don't have a hard date on that, but I would project it's probably closer to 2026.
Yeah.
So
Exactly.
it is a
Build.
fast timeline for construction for
Right.
buildings, so it's incredibly fast.
Yeah.
So we're working real hard with our partners to stay on track with that.
and, I just wanted to ask, the reports, the review and the audit, can we get a copy of those? Or-
Yeah, those are public records, so as soon as that comes out and we submit a corrective action plan, they'll approve our corrective action plan, and then we implement it, and they come back out and review, and then they issue the final report. So it's a long process, but they post those on the California Department of Public Health's website for those reports. So they usually every 3 years, I think they hold them up there for 3 years, maybe 6. I forgot the last time I looked. But yeah, that's a public document, and we can definitely share that with the board once we have that.
Great. Anyone else? Communication, or, okay. AOT update is on here. You got anything, Jack? Or just tell us how you are.
Tell you how I am.
Yeah.
I'm doing really good. Thank you for asking. So AOT is going good, I think. We're full. We have 10 clients over there that they're helping, and they feel like based upon their staffing, that's about what they're able to manage. do have psychiatry for the clients that are in AOT. They've had that for a little while, but they've also added on some nursing support for AOT clients. So they've contracted with a nurse to kind of provide that service for the folks they're helping, and that's kind of just started out. So I don't have an update on how that looks, but I think it's, we found that sort of nursing case management with some of our CCT clients is really invaluable in terms of med compliance and making sure that the response to medications are going well. And so I think that will be a good benefit for them. So yeah, that's kind of where we're at with AOT. We are kind of looking at some more education and training opportunities for the community to highlight the program and fulfill that mandate for training. And then we're working on currently our sort of outcome measures for AOT as well, and we'll present that to the Board of Supervisors here hopefully within a couple months.
Does anyone know if the lease was signed on the navigation center?
That was signed 2 weeks ago, yes. That's the reason I was asking you, if you wouldn't mind asking if there's any other progression report on the navigation center, because the lease was signed 2 weeks ago.
Connie usually reports on that. Anybody else here have any info? Nope.
Okay,
Nope.
thank you.
Committees, we kind of went over that.
Someone has a hand up, Sharon.
Thank you, Sharon.
Hi, I just want to really quickly give you an update. The Board of Supervisors submitted 2 letters to the governor asking him for his signature on a couple of the bills that the Behavioral Health Board had asked the Board of Supervisors to support. So those have been sent over, so that's great. Those bills that the board had decided to support are still pending on the governor's desk, but we do expect that they'll get signed, hopefully. And the governor has until October 14th to decide to sign or veto bills. So you're going to see them trickling out between now and then. But that was a good update from our Board of Supervisors. Appreciate that support. I do have a status report on those bills that I could provide to Joe to distribute if you'd like. And it includes a link to those Board of Supervisors letters, so you could get a chance to see those as well. And we are just continuing to monitor the bills that have gone forward. The Behavioral Health Services agreement changes. The proposal from Governor Newsom has passed. It will be signed. It's not signed yet. It will be signed. There will be likely a signing ceremony, so you'll see it in the press. And just so folks know, start getting used to the term Proposition 1, because that's what's going to be renamed on. It'll be on the March 2024 ballot, the primary ballot, and it's both the bond measure and the changes to the program combined. But that will be known as Proposition 1, and you'll start seeing a whole lot of media coming out as the campaign season kicks on. I just wanted to provide that quick update.
Thank you, Sharon. Yes.
So Sharon, you said you would provide the link to those letters. Yeah.
Yeah, absolutely. I'll send a copy of an updated status report of those bills to Joe, who can then distribute it to this group so that you all have that.
Okay, great.
I heard on the news the other day, and I think it's you who is speaking that I would ask this to, that the governor has signed or is going to sign a bill about something called Care Court, which will have people who are homeless and mentally ill will be given a chance to have medication and treatment. And then if they don't do the medication or treatment, they're going to be conserved. And I wondered, and it seemed like, right away, I thought with my background, wow, that's gonna be a lot of staff and a lot of, for every county. Is that something that, this board's gonna take up? Is that something that, the
Marguerite,
department is taking up?
we have had a few, presentations from staff on that. And I'm happy to email you, we have recordings of these meetings. So there is sort of what they're looking, if you'd like, I can email that to you.
Right, mostly I was just wondering how a small county like this was gonna cope with that.
Can I answer? Okay, so far when it comes to care court, the changes, as I've learned from Sharon Wolf, is that there's too many changes that are occurring. They haven't actually come up with a working prototype. And there's no way to see how it's going to affect counties at this point in time. It's still evolving.
Okay. Yeah, I knew it was really early days.
So that is a great way of summing it up. I know there's a care court update on the agenda, so we can provide a little bit more of an update. It's already done. It's a done deal. It's not a bill that the governor needs to sign. It is happening. But when we get to that agenda item, I can provide a little bit of an update.
Thank you so much.
So the next item is chairman, vice chairman. Vice chair's not here. Chairman, we'll pass to you, Sharon. We've already talked about navigation center. And so 9B is care court.
Okay, that was a short break. What I tell you is that we don't know a whole heck of a lot. The cohort 1 counties, there's 7 counties that have to implement this first. Thankfully, we're not one of those. They're implementing it as of Monday. And this is going to be very interesting to watch. All the counties are watching this to see how they implement this, because it's huge. And we really don't know all of the changes. They're going to be figuring it out as it goes along. So we've been monitoring it closely. We attend the trainings. They have procedures now. The Judicial Council has come up with all the forms that they need, all the procedures. I was just at a training that was intended for all of the public defenders and the legal representations. So they believe that they know what they're doing. They have a process going forward. But of course, as soon as you actually try to implement something, then, that's when you identify issues that need to be resolved and addressed. So again, we're watching it very, very closely at all times. I'd be happy to send some information again with that report I'll send to Joe, with some links and some places where you could get additional information if you want to dive into this. And if you can figure things out and let me know, I'd really appreciate that. There is also, Care Court was featured on 60 Minutes recently over the weekend. There's a link that you can see from that. Again, we are really just watching these other counties as they start to implement it and seeing what problems they identify, the impact to the staff, the court time. There's a huge amount of court time, and all of those little details. We are going to be watching this roll out. Yeah, I wish I had something more firm to give you. Humboldt County, since we're in Humboldt in cohort 2, we've got until December 1st, 2024 to implement it locally. So again, we're going to be learning from the other counties as we go along, and that'll be a huge benefit to us. We're not having to kind of jump into that first. So we will be learning. Are there any questions that I could hopefully provide an answer to, but probably not?
What's your favorite flavor of ice cream?
Go to Costco and get that wonderful vanilla ice cream that they.
Thank you, Sharon. Before we move to future items, Oliver, did you have anything you wanted to say?
Yeah, definitely. Kind of fits actually with future items, right? So I reached out to Laurel about a stakeholder meeting for MHSA. So I am hoping that maybe we can schedule something in November So I kind of discussed MHSA, some of these proposition one initiatives are gonna be maybe coming down the pike in March, 2024 ballot, right? Or 2024 ballot. So yeah, that's really ultimately what I really would like to do. And in this presentation that I'm developing right now, again, there's gonna be a lot of general updates as to what the final language entails in SB 326. The substantial impacts it could have on MHSA and how it's being restructured. I mean, for reference, it's being rebranded into the BHSA, right? So how it's going to break down funding streams and overall how it's really going to affect how we utilize MHSA altogether. And then by the end, hopefully we'll be able to kind of discuss potential impacts too, because that's something that is kind of causing a lot of anxiety amongst the whole state right now. Unfortunately, MHSA is a tool that we utilize to fit our individualized needs in counties. And that means that impacts are going to be very different county to county, right? So, yeah, just wanted to kind of mention.
So in the past, we've had an MHSA ad hoc. If anyone has any interest in being involved in that, please let me know. But yes, we look forward to stakeholder meeting in November. Go team. Does anybody have any other future items they would like?
Yeah.
Guess what? Guess what?
Now, recently Joe sent us out some information where it had to do with, it was just a couple days ago or even yesterday, maybe about, billing problems or funding. Yeah, is that it?
Yes, ma'am.
Thank you for that, Mary. I didn't print it out. Anyway, it was directed to us and we may have to talk about taking action. I was hoping for more info about it.
Okay,
Maybe next meeting.
Colleen, did you have a comment?
Well, it related to it, and it appeared to put a burden, a financial burden on the county to subsidize the mental health services until the process got, fixed. And I was just wondering if anybody could add to my perceptions or misperceptions with a little more detail, because that seems to be very heavily and significant if that ends up being the result.
So this is for billing, you're saying?
It was in regards to the email that Joe sent us. And
So who from the county would have the information about how this will affect us? Really? Yeah. So maybe we'll just put it on the agenda for more information. I cannot remember, is Emmy gonna miss the next meeting as well? Vague recollection, she's missing 2 meetings. Do you know, Joe?
She is, yeah.
Yeah. So maybe we'll just email her and see if we can get a response. Is that adequate? Okay. Anything else?
Could you say what that's about? Because that doesn't make any sense to me at all. What is that note about?
That's what we're trying to figure out.
Oh,
It was just sent out a couple days ago. We're gonna ask for more information.
Yes.
I thought it had to do with wanting the behavioral health boards to advocate with the supervisors that they would provide stopgap funding.
Yeah.
So, but it's kind of new, so a little more info would be.
But just that whole notion seems very ominous.
So we can ask our DHHS people what they know, and then we can also do research on our own. I don't have any information. Anything else? No future items? Who wants to work on data notebook with Laura? What? Woo, woo.
You're looking at me.
Data
Just sure.
Awesome.
Work off it, Ramon.
Future items, Laura and Virginia will be working on the data notebook and the annual report together.
I'm glad to volunteer.
Yeah.
Yeah.
Hi, what is the topic of this year's data notebook?
I'm sorry, can you say it again?
Yeah, what is the topic of this year's data notebook? I know
Oh.
each one has a different focus.
Right, so this one is, the topics are adult residential care. Questions about that. Homelessness programs and services in California counties. CWS, foster children and certain types of congregate care. And stakeholder engagement in the public mental health system.
I would like to, please.
Awesome.
What is a data notebook? I'm asking. Sorry.
So, I would say that's part of what our board is supposed to do is during the year, we gather information from behavioral health, HHS, and then every year, it's at the count, what's the entity? The California Behavioral Health Boards and Commissions sends out this notebook where we answer questions about the knowledge, how our county's doing, what we know of that. In the past, when I worked on these a few years ago, it was trying to gather the information afterwards. Now we have what it's going to be. The questionnaire needs to be filled out by November 30th, but I do know that we have submitted it late in the past, but we're gonna not do that this year. But we need to educate ourselves on how our county is doing in these certain areas. So that's the data notebook. You can Google it. You can see past years, counties who fill it out, and some counties don't fill it out. So we're going to be working towards getting all of those things filled out.
Okay, thank you very much.
And just a reminder, if you haven't done your ethics training, you should get it done as soon as possible. Board members. Yes.
If we have the certificate, do we give it to you?
Yeah, or you can email it to Joe, who's keeping track of it. Yes, thank you. Okay, is there anything for the greater good? It is 1:10. Am I gonna adjourn this meeting? That means I'm gonna make it 2 o'clock. Is it a meeting that I thought I wouldn't make? Oh, my goodness. All right. 1:10.
There's a hand up still.
Oh, Bella, do you still have a question?
I just asked Bill.
Yeah. It wants to work on data notebook. How about that? All right. Adjourn.
Yeah. We're gonna have a party tomorrow at Tri-County and we're gonna make buttons as little presents, so I get to go do something fun. We have a button machine. I know, I bet for it. It's a great idea, so now we have to fight to make 1,000 buttons. So, about disability justice, about LGBTQIA justice, about any justice we want. It's so fun.
Yeah, I used to do that.
It is a blast. I haven't been able to do a fun little silly thing like this in like 2 or 3 months, so I'm like, I need it.
I'd like to make sure. Thank you.
I guess so. I can get mine back from you.
Did you want information about the things you're presenting?
It says it really. You're ready for discussion.